Hello, and welcome to the Health GoLive Webinar series. Today's episode is brought to you by our friends at League. We would like to remind you that the Q&A feature is available, so feel free to send in your questions and comments throughout today's webinar. We would love to hear from you. And with that, I will turn it over to our moderator, Jody Tropiano Green.
How's it going? So we're excited to be here to talk about harnessing engagement, a pathway to untapped value for payers. So just to set the stage a little bit, health engagement has historically been somewhat of an enigma. So the health industry agrees it's important, but success has really been few and far between. One of the biggest factors why initial investments in health engagement maybe hasn't panned out like we thought it would be further investment in legacy systems that were never really designed to drive engagement. So it's time for healthcare to go deeper and to commit to the consumer. Today's expectations from consumers is at an all-time high, and healthcare really hasn't delivered when it comes to personalized experience and just a high value experience like we've seen in other industries like entertainment, retail, banking. So it's a bit of a problem, and that's what we're here to talk about today. So I'm excited to be here with these CX leaders who are tackling this engagement problem head on. We'll dig into their strategies for delivering engagement solutions that drive impact, the tangible business value available to payers, and the opportunity costs of inaction. So without further ado, I'll let you meet the panelists. So if each of you can just give a little bit of your background and set the stage for your current role. And then also I thought it would be fun to kick off the conversation for each of you to give maybe your true north, your gold standard for a consumer experience in any industry. So let's kick it over to Josh to kick us off.
Great. Good morning, Josh Good, former CIO of Scan Health Planning Group. I was Scan CIO for approximately 12 years and recently made the decision to step aside to focus on other opportunities, still operating as a senior advisor with Scan these days. Prior to that, I spent 16 years with Accenture. So probably a rare, person, 28-year career, had two jobs. So at Accenture, worked in their payer practice primarily. So to your question there, the best CX experience, and this one probably goes back a couple of years. I don't think their experience is as great nowadays, but I've always been a big fan of Expedia, the travel website, where, I do a lot of travel, being able to manage the travel. And the things I like about Expedia, they're able to be really proactive. They can anticipate my needs. I'll pick up the phone and I'll call them, and they'll have insights into what I've been doing on the website, and they'll, obviously do the basics like address me by my name, but also talk about, hey, can I help you with this flight you were just looking at? So I've always been a big fan of their experience. Actually, I have a funny story where I was on a plane one time and I was going to be delayed and potentially miss my connection. And I went onto their app and I just did a chat and said, hey, is there another flight? How much is it to move into that flight? And within probably 30 seconds, someone said, yeah, there is another flight. Do you want me to move you onto the flight? And I paused and I'm like, well, I didn't think this was going to work. Can you, and I ended up, making the flight ended up taking off and I made the connection. I didn't change it, but they've always had a really good experience that I've been impressed with.
Yeah. Airlines, not so much. Expedia,
Yeah,
yes. Yeah.
right. Exactly.
Amazing. So Kathy, how about you?
Good afternoon, Kathy Wolf. I am Senior Director of Care Management with Capital Blue Cross in Pennsylvania. I am a nurse by training. I have over 20 years devoted to the insurance industry, focusing on clinical operations. So I have experience in utilization management and care management. A lot of my experience is in healthcare initiatives, workflow optimization, really focusing on that recently. So this is a great topic for engagement because that's really been one of our focuses lately as well. And then reporting analysis. So I know another area where we're talking about data and good data and real-time data. Those, in my role, I lead efforts to ensure quality of care, improving outcomes, and managing cost effectiveness and streamlining efficiencies as well. So I'm here today and excited to talk to you about engagement and transformation. On the gold standard customer service, I don't have one specific, but I just think overall the experience of when you have options, right? And I think we're going to talk about that today as, whether it's a digital option, if that works for you, or that, and also having that opportunity for in person, right? Because we've all kind of sit and sometimes we struggle with going through all different options and then to find out we can't connect with somebody. So I think just the gold standard of all customer experience really is providing options for everyone.
Yeah, that's a good point. All right, Sarah, bring us home.
I'll bring you home. Well, really, we're just getting started.
Yeah.
Hi, everybody. I'm Sarah Donnelly. I'm the Chief Product Officer at League. I've been here for about 4.5 years, but I've spent 20 years, more than 20 years in healthcare. Super passionate about the space. I'm very eager to make a difference. I think there's plenty of places that you can make a difference, which makes it a great spot for me to stay interested. At League here, we are a customer experience software company, and we work with healthcare innovators like Kathy and Josh to deliver really best-in-class digital experiences that are much more like the consumer experiences all of us use every day. Our goal is really to help people do, of course, all of those basic transactions really well, but our real goal is to help achieve better health outcomes so that people can live longer, so that people can have higher quality lives with their loved ones and really just get the most out of this one life we all get. In terms of my favorite product, I could probably talk about this for the full hour, but not to like jump on the hype here, but I've been really diving deep using AI products in my work life and in my personal life. I had to get upset with my 10-year-old son yesterday because he was using up all of my Chat GPT free credits. So he was asking what the first 10,000 numbers of pi were. And I was like, don't use it for that. But on the work front, I've been really leveraging a notebook LLM. So I'm loving how you can put multiple source documents together, get insights, create agendas, process different types of points of view, and bring together, kind of a collection of thoughts into one spot, much easier than before. So loving that.
Yeah, not having to take notes on
Yes.
calls anymore is game changer. I can actually listen to the person I'm speaking with.
Yeah.
I wasn't going to give an example, but I just had this experience this morning, so why not give them a nod? But the Rent the Runway for renting fashion. A lot of people in New York use it, but they have an amazing app. They are so quick to resolve any problems. And if you're a longtime customer, they value that. And I feel that as a longtime customer of theirs. So I think they're really doing it right. Okay, so let's get into it a bit. So I think to set the stage, probably makes sense to first define how each of you define the term health engagement. I think a lot of people have different definitions. So if you can let us know how you define it and what an engaging experience will look like from a member perspective and then from a payer perspective. So anyone feel free to jump in, and that's the rule of the panel. Anyone jump in, don't wait for me.
I'll start, and I usually keep my, definition around, health engagement pretty simple. But, when I think about health engagement, it's, the strategies, it's our process, it's our programs that, we use to really engage with our members in managing their health. And I'm thinking about that from a, more from a payer perspective. And this can be across, any channel. I mean, I think Kathy mentioned it earlier, in person, this is, it's not only, digital usually comes to mind when you think about health engagement, but it's also, analog in my mind as well. And I think part of the challenge and the opportunity is how do you bring all of that together with the overall goal of, you want to be proactive. We want to make healthcare proactive. Healthcare is often, very reactive. You engage with the system when you need it. But how do we get in front of that as a payer and be proactive and try to anticipate needs? So that's
Yeah.
kind of the way that I define it.
Yeah, I would build on that a little bit, just thinking about what does health engagement mean? I think for League, we are looking for members to be more proactive about their health. I think a lot of health decisions are put off, they're delayed, they're not convenient, it's not easy, people feel challenged to get access to the care that they need, or they don't know how to go about it. And so what we're really trying to do is change the paradigm so that people have as many of those barriers removed as possible and make it really simple and clear so that people can understand the right thing for them, and they don't think like, oh my goodness, I'm going to have to call 3 people and find out who I'm covered for. I'm going to have to then try to find out if they have availability. I'm going to then have to wait and see if I can get an appointment, but oh my goodness, what about the wait time? All of these things that stop us from taking care of ourselves. So it's really about just trying to figure out how to keep people engaged so that there's not those barriers to them being healthy. And I'm like completely guilty of this myself. So I like use my own my own delayed care as a it's a motivator.
Yeah.
Yeah.
Frictionless, not to use a buzzword, but I think
Yeah.
that's important. Kathy, go ahead.
Yeah, no, go ahead. Kind of like Josh said, like being proactive and not reactive, right? Getting that engagement up front. And from a payer perspective, health engagement is that really that bi-directional, right? We have to make sure, from a care management. So I'm speaking from care management and making sure that, the members engaged as well. Their active participation, they're responding back. So I feel like, engagement is really being actively involved in managing their own health and understanding that, along with making their decisions and making those changes to really promote that. One of the things from care management, promoting self-management in the member. So making sure that their care plan is individualized and member-centric to them, and really that they, are able to, they're motivated, they're collaborating, and really from a payer point of view, making sure that we're all collaborating, right? So it's a large team that's all involved, the providers, the members, the family members, and really making sure that we're all collaborating and engaging that. Like, it's really a central goal in understanding that journey, and from a member experience, I feel like them showing active participation, whether it be with, in-person care management, digital solutions, and those participating in that as well.
Yeah. And so getting this right, what metrics, results can stem from this, and what can it drive for the business?
Yeah, and I can speak, I would say, metrics, member satisfaction, right? We always are looking at that as well. Improve better health outcomes, cost avoidance, looking at that in addition to, HEDIS scores and everything like that, measuring that for readmissions, ED utilization, all of that, making sure that they understand that. And so those are the metrics that I think that, we can look at as well.
Yeah.
I like how, Kathy went to the business metrics there too, because one of the things I've seen as as an area of opportunity in the industry, a lot of people get focused in on more the transactional metrics. What is our traffic? What are our, registrations on the portal, and not as focused in on, the health outcomes. I think you need to measure both of them. And I think one of the opportunities that I've seen is, having the dashboards and the cadence around, including both of those type of metrics, and where you're really monitoring those and you're talking about it, because they're both important. And then the health outcomes, I mean, for me, those are very important when you're thinking about, getting investments with your CFO and digital and things like that. Those are the metrics you really got to talk about, is how is this going to drive, value? How's it, for the organization? How's it going to drive quality for our members and really improve the experience for them?
I totally agree. It's too often we see people really focused on just the leading indicators. So how many people do we have coming into our digital experience versus calling on the phone versus we're reaching them by mail? It's really got to be like downstream from that. Okay, now when they're engaged, what are they doing? What actions is the digital strategy driving? How is it complemented by the care managers? How is it complemented by the other programming that we offer, point solutions? So it really does have to be looked at holistically.
Yeah. Yeah. So engaging people at the right time in the right way. And I imagine your CFO would ask, the next question, how are we going to do this? So how are we going to bring this to fruition? So maybe you can walk us through kind of the steps to realizing these better experiences, specifically from the payer perspective, I think would be helpful. Maybe Josh, you want to kick us off?
Oh, and it's not easy. I mean, obviously, I mean, if it was easy, we would all be experts in it.
Sure.
And I think that's part of the reason why healthcare has been, lagging some of the other industries. I think it's just, healthcare is complex, and we have these large, complex digital ecosystems with, complex data. So I think it's, how do you tie all that together across all the different channels? I mean, even if you just talk about like the metrics there, I mean, kind of the example I was, alluding to there, I see a lot of, companies that really focus in maybe on their contact center metrics. They're all over turnaround time and all that. But you really have to step back and you have to look at what are my engagement metrics across all my different channels, and then, how do I improve that? And, I've always been a big proponent of journey mapping so that you really understand, the experience across all your different channels. And then how do you build and align the underlying technology stack to be able to support that? So it's usually a collection of applications. You think about a CRM, you think about your portals, your apps, all your different engagement areas of engagement, and how do you bring all that together? I know we'll talk more about data later on, but data is a very key aspect to that, to really driving a great solution, great experience.
Gosh, you just really, like you say, a journey map. And I'm like, give me a whiteboard and a stack of stickies and set me free. Yeah, it's so important. We do see, we at League, we work with payers of all shapes and sizes, and we do run up against this problem. The bigger the organization, the more parties are involved, and getting that holistic strategy is really, really challenging. And so I do think it's completely worthwhile and critical to get that overall picture of how is the member engaging at different points and how do we bring that together. To build on like the data comment, I'll just say that the number one thing I hear is that the data, but what about our data? It's not perfect. We're not ready. We're doing a cloud migration. We're partnering, we're doing this. Like, the data will never be perfect. As soon as it's perfect right now, you're going to get a brand new system, or AI changes the game, or you've got a whole new business that you've just acquired. Your company has gone and purchased another plan. So data will never be perfect. I think that from my perspective, the best thing to do is use the data you have as well as you can in the given moment, and then always be iterating and always be looking to say like, okay, now what can we bring in? Because if you wait for too long, I always tell people like, we need to meet your data where it's at, but the kind of like, you want to meet the people where they're at, the members where they're at, the patients where they're at. Data's the same. We just need to get it where it's at and use it the best we can, and then keep improving.
That's a good point. Kathy, anything to add?
Yeah, kind of how you opened up about engaging members at the right time. And I think that is really important. The right time, the right message, and the right channels. As we know, different population and ages, how we connect with them. People are busy, lifestyles are busy and working. And so connecting through a digital, whereas, maybe our older Medicare population maybe would like more communication. They're there to answer the phone. So I feel like, finding out what that right channel is requires just an approach, number one, from technology, operations, and really focusing on that. And kind of, as I said earlier, that's really been a focus for us, is optimization. How do we increase our engagement? How do we best connect with members? Answering the phones when an 888 numbers, people are not doing that. So really looking at opportunities, that's what we've really focused on how to connect with that. And really just, real-time trigger. So data, and kind of to your point, data's not, but if we have something, and, it's kind of like change management, right? Like I think Sarah said, you have data, but tomorrow, and it's just really changing with the times, and just getting that data to be able to give you that real-time triggers to get more upstream with members, get them at the time of need, and also meeting the member where they are and having them understand what's in it for them. Because I think sometimes that makes a difference. If that member understands what's really in it for them, we're here to help you. So I think that that's really important. And, from a payer perspective, is just working with, our marketing and member experience teams as well, because sometimes people are just like, oh, my insurance has care management, right? So getting them to understand and working with the providers, like in collaboration with that.
Mm-hmm. And how much are you tailoring your strategy around the different types of members? You mentioned Medicare, I imagine you have a lot of Gen Z members who will never answer a phone. So how much are you taking that into consideration?
So we are evaluating that. We've done some things with virtual care visits. Like, and when I say virtual care, it's virtual care management visits, which allow that face to face. So that's something recently we've put into play to do that. As we said, Medicare members do answer the phone. They're home. So we're looking at texting options, any digital solutions. At this point, we're looking at opportunities with that, and really even working with providers. So we've done a lot to do provider outreach and provider collaboration. And so when that member maybe comes in, they're like, hey, your insurance has, kind of just working and understanding that, making sure that we're available because, during our commercial younger population, people are working, being available in the evenings also as well, and what's the best time for them.
Yeah. Amazing. So I think we've established kind of what the goal is here and what a best-in-class member experience looks like. So let's talk about the value side of the equation for a bit. So, obviously I don't need to say that it's given the current market, it's tough to get, CFO buy-in and be able to make these investments from the payer perspective. So just how do you kind of put health engagement at the top of your priority list? How do you make that case to your CFO? Given that dollars are getting cut in the market currently, like how do you keep this as a prime investment opportunity across your organization?
I think it goes a little bit back to, what we talked about earlier around the metrics and really having a good, attribution model of what is the value that each of these, different capabilities, whether it's a digital capability, analog capability, what's the value that it's going to drive? And if you look at, and I'm thinking about and talking about this for, a payer perspective, you can't just compete on benefits alone. There's been, a lot of competition over the years on, getting aggressive on benefits. You also have to compete on, what is that service experience? What is, the quality and what is the level of care that I can deliver. And a lot of that is moving into, more of a, the non-traditional settings, the virtual, the digital settings. So, if you're not investing and you're not keeping up, benefits is probably more of a short-term play that's going to, win you some membership and, some growth. But if you think about it from a long-term perspective, that service experience, that quality is really going to build your brand and get you to where you want to be and from a long-term perspective.
Mhm.
Yeah, I mean, from my perspective, and I'm not sitting in a pair org right now, but working with a lot of them, I think the main focus for everyone taking on a digital transformation and trying to focus on health engagement, you've got to go back to what we were touching on earlier and focus on the outcomes that you're driving. A digital experience, a call center, all of this is a means to an end. What is the end? The end is these health outcomes that are really going to help drive the financial goals that your CFO has, but and also make people healthier and better. So I think it used to be, 15 years ago, 20 years ago, your digital experience was your website. There wasn't a logged in experience. There wasn't much of a digital experience. It sat in the marketing budget. It was a marketing initiative so that they had, a website that people could go to. It's now a core part of a user's experience and an expectation that the next generation and this current generation, quite frankly, have. And so it's another communication channel as important as your call centers or other ways that you've communicated with members. And what are those for? Those are for outcomes. So the framing of the problem space really needs to be on what outcomes you're trying to drive, and that's how you work with the CFOs of the world and make sure that you're having the impact you desire.
Yeah, I would agree. And I was kind of going to say similar things about the outcomes, really, and kind of how I mentioned earlier about being, proactive in making those changes in preventative care, because in the long run, if you're making those changes for preventative and well-being, the chronic conditions later hopefully will be well maintained, and, and looking also at, making those healthier lifestyles to build confidence in that member. And then also just helping navigating the healthcare system, right? Making sure, we're getting those services available. And when we're looking, we talk about our members and customers. So as from a payer perspective, our customers are our members and our customers are our employer groups and all of that, and really working with them, to demonstrate the outcomes that we are seeing as well. So I feel like, high, reducing ED utilization, admissions, and just overall healthier behaviors. And offering those digital solutions as a preventative is really important too as well, making those changes.
And I was going to ask about how do you kind of prove this ROI? I know sometimes it could take a while to prove the ROI of these new solutions that you're standing up, but realize our next topic is data. So we'll probably get into that answer within this conversation. So let's talk a little bit more about data. We obviously need it. We need it in the right place. We need it to be accessible, and we need it to communicate. So where does that get us? Where can data take us? How are you using it to measure ROI? Big question.
As I said, there's a lot in that question there. So, when I think about measuring ROI, using the data, and it's not always clear when you think about it from these digital channels, but you can go back and you can do attribution around, what is an engaged member? What is my medical cost? And prevent, I think Kathy alluded to, being able to get engaged and do provide preventative care, how that is, preventing, hospital admissions, things like that. So I think you have to extrapolate it there. And then when I think about, data more broadly and really driving driving health engagement, I think about, organizing your internal data. You think, I mentioned it earlier about, from a payer perspective, we have a very, complex digital ecosystem. You've got, your analog, you got your digital channels. How do you aggregate all that information? And your goal is really to understand, all you can about your member, your patient, and then also about where they're at in their journey, so that you can really predict, what do I need to do to intervene and make this easier for them? How do I make it simpler for them? And it's doing it internally and then also externally, and thinking about, always you would talk about, as a payer, CIO, I feel like it's like my moral imperative to aggregate the data for my member across the healthcare ecosystem. So whether it's, getting data from my, PBM, or getting data from, my providers, I need to have access to that to really be able to aggregate it and understand, what is my member going through? Where are they at in their journey? And then how do I help them? How do I make it simpler? How do I make it easier for them to get the care, the experience that they need to have? So, long-winded answer to your big data question there.
A
So,
good one. Yeah, it's a big topic, needs a big answer.
So one thing this is not a super well-formed thought, but I'm going to share it anyway. So, we've been doing a lot of thinking at League about AI and how to use AI in our products. Recently, I found out that I have high cholesterol, which was surprising. I didn't think that would happen to me. I don't know why. And what the first thing I did was go to ChatGPT and say, I'm freaking out. I have high cholesterol. Am I going to die? I'm like, I want to, I've got 3 kids. I don't want to. And by the way, my LDL is the one that's a problem. Like, what now? And ChatGPT gave me a bunch of answers and things like that. So that's becoming the norm. People are going to use Google the way they've been using it. Now they're getting even more in-depth information and answers from public sources. I think what payers and companies like League need to lean on is that the data that we have about our members, about our patients, is going to be what allows us to give more comprehensive and rich answers to people in their moment of needs. So if you combine the power of these LLMs in the future with the data that you actually have and know about a member, the amount of impact that we can drive is far greater than anything we've been able to drive before, because the tools are getting more powerful and you've got this data on these members. You understand them. You know that I've had 3 kids in the last 3 years. You know that, I'm working at this job that might be causing me stress. And so there's a whole lot of personalization that can happen inside a payer's portal if we take that data and use it to really reach a member like me and help me figure out how to prevent heart disease from really forming. And I think that's kind of the future, is figuring out how to pull more of that data out to give the person really personal insights about how to help keep themselves healthier. So it's connected to the outcomes, but I think it's really like a timely distinction as we all think about our data strategy going forward.
That's a great point. And even just wondering too, for Kathy and Josh, that LDL finding, what if you had made that finding in a function test that went around, insurance that was cash pay, or through, I just went through fertility treatments that was fully cash pay. So there was a lot of insights about me that Aetna has no idea about. So how do you look to bring in that data source?
I'll start and then Kathy, I'll let you add to it if that's all right. But and this has been a topic I've been talking about on, last couple, speaking engagements I've had at conferences where, interoperability remains a challenge. I mentioned earlier, I've been in healthcare, I've been doing this for 28 years, and we're incrementally better at exchanging healthcare data today than we were 28 years ago. And and I worry about us as, a country where I look at some of the other countries that have solved the interoperability challenges. One of the examples, I've looked at and we've talked about with some of the, the individuals I network with is, Australia. They have a digital health registry you can opt into and share your clinical data. And you think about AI, data is the field of AI. And I think about, from a payer perspective, and then even some of my health system CIO counterparts, we're missing a lot of data. If you think about our members, our patients, we don't always have that data, whether they went to urgent care or, we don't have that longitudinal health record. And you kind of gave that example there, Jody, about the LDL. But I think about, could you imagine a world, and I think other countries are close to this, where, there's a full longitudinal health record of an individual over, 10, 15, 30, 40-year lifespan. And you can compare, a blood test you had when you were 15 to one you had now, and have AI just running in the background doing that and proactively looking at and screening us for, preventative, care. I mean, I really think that's, the point where AI is going to unlock a lot of capabilities that, if we don't have our data organized, we're not going to be able to take full advantage of from a country perspective. So I've been really, pushing and promoting, we've got to solve this interoperability challenge to really be able to leverage AI to the fullest extent.
Good point.
Yeah, and I would add, I know that is a challenge too, right? If somebody, even from somebody who's at another payer, right? And they come to us getting that information. So we also working, have a project, ongoing project. It's been a few years and probably continue for a few years of interoperability, right? And getting that all together. So, we are actively working on that, but it is a challenge. And so that's where, us working with provider collaboration as well, maybe being able to get some historical data as well, expanding EMR access and different things as opportunities as well. So that is, a challenge in understanding that for somebody does something self-pay or along that line as well. And hopefully, that you get that through your engagement and communication with the members as well. And back to the data, it really is the foundation really of our engagement, and it's different things. So for us, it starts with really the data, our ID and stratification, right? Identifying those members who, are high risk, impactable members. So looking at that. So that's where data is really key with that and getting us, to those members, along with then, the proactive, the predictive analytics, right? Pulling that from our ID and strat and looking at that as well, being able to give us that little bit of jumpstart to maybe get to somebody to change those habits, along with, the real-time data is important, getting that, I think I said earlier, meeting the member where they are at that time of need, right? And, today we do transition of care, getting that member as soon as they're discharged from the hospital. But even if that member's not, and how do we get to them sooner, really at that time of diagnosis and that. So real-time data is really important. Plus, and then, independently, then we talked a little bit earlier about the values, the data showing, right? I talked earlier, we did a lot of optimization, some different things, to increase our engagement, and, the data, that's kind of what we need to show, right? Well, with the implementation of this, we increased our engagement by this. So those are just different areas. So data is just so valuable in many different ways, and making sure that we have that.
Yeah. So I want to make sure we can talk about AI for as long as we need. So we alluded to it a little bit, but obviously AI, Gen AI, agentic AI are making huge headways in all areas of healthcare, but I think member engagement, there's a lot of promise there. So would love to kind of hear how you're using it to improve member experiences and contributing to your business's bottom line. So how is AI being used to shift this value equation for health engagement?
I'll start and I'll talk a little bit about obviously, some of the things that we did I did at Scan. And I think when you approach AI, and obviously we're several years into what I consider the Gen AI revolution. You got to look at it, broadly. You got to look at it from a governance perspective. You got to look at it from a responsible AI perspective. And then even an organizational perspective, how is your organization designed and structured? One of the things I did was set up an emerging technologies team that, I wanted it to go horizontally across my delivery towers and my business teams to really make sure that we are leveraging AI, the latest technologies, across all the different functions and bringing that together to drive, whether it's, something from a care management perspective, from a operational perspective, or, from a member experience perspective. And, I think across all three of those areas, there's a lot of opportunities. I mean, part of my challenge as a CIO is how do I balance all those opportunities and deliver, to my business users. And, we were really successful, across all the different areas. And I think about some of the things that we were doing from a member experience. One I was really, excited about was, and we were in the process of, implementing a new CRM, really getting the right information to our agents, and then also getting to a keyboardless experience for our agents, where I was trying to drive to that. And if you think about, anybody that's worked in a contact center environment, kind of the progression over the last, several decades, where you get these complex ecosystems in a pair. It went from an agent would go into 10, 15 different applications to we got CRMs. We, consolidated some of that data and they were only having to go into, one application or maybe two or three, and then it's, 10 or 15 screens. And, we had implemented a solution, at Scan pretty early on that, had that AI agent that was running and listening to the call in real time and providing the information to our agents in real time. So they, don't have to go look up anything in some cases, and really making it easier for our agents to be able to drive a better experience for our members. And I would often say that, a contact center agent has one of the toughest jobs of any job out there. They have to be an encyclopedia. They pick up the phone, they don't know what that call is for. And if you've got an AI agent that's in the background, really, going through your data and providing that information to you, the example I gave earlier about Expedia, providing the information of this member was just doing this, on the website. It's really going to allow you to drive that, much bigger experience. So that was one of the things we did. We had implemented a lot of solutions across Scan and built our internal AI platform as well. But I think there is a opportunity to really fundamentally change the member experience leveraging AI. And the human still needs to stay in the loop as well. So it's not eliminating the human altogether. So
Agents plus AI agents equals
yes,
magic. Yeah.
exactly.
And even just not having the member sit on hold after every question. I mean, just
Yeah.
that little thing could increase the experience tenfold.
Yeah. Yeah.
I would say from a payer, and we know AI is rapidly transforming how it's delivered. And so that is an area we continue to evaluate opportunity solutions. We are piloting some with our customer service reps, like about an auto summary. So really providing those efficiencies actually with a call right after that member and then summarizing that. So looking at that as well, along with our predictive modeling. So we, are evaluating a lot of AI opportunities, and looking at that. And, while AI will be good, it'll also help to support even kind of, I think Josh said, that not losing the human component of it, but that AI can actually help to support the human, with getting that information in more real time. So we continue to evaluate AI within our systems.
I can imagine what
Yeah,
your inbox looks like with the amount of pitches you're getting. What, I guess, just for startups in the audience, what would stand out to you?
Oh, sorry, what would stand out, like AI?
Yeah,
From
our
an
pitch
AI
email,
In the
Kathy.
sea of pitch emails that you're getting, is there anything that would
In my emails, but helping with efficiencies, right? Documentation. I think that as well. And just from a digital solution, AI, helping within that. So that's what I get about a lot of digital solutions and AI. But also it's kind of equal of efficiencies for our teams, right? As well. Being able to, have those resources right available while you're in the system and having that trigger off of that. So yeah, there's lots of opportunities and it's really an exciting area, and we know it continues to grow and transform. So look forward to coming back and sharing, which path we had.
Now all your subjects on the emails you're getting will have efficiency in it. So
Yeah. Thank you for that. Right.
Yeah. Yeah, just Jody, I'd add a couple things to that. I mean, I thought it was a great response from Kathy. But I think, don't lose sight of, trying to, what we talked about earlier, change health outcomes. And those, I do see a lot of vendors come in and they really focus more on the tech versus the outcomes. And, the way I like to think about it is, we're still trying to solve a lot of the same problems that we've been around for decades. Now, how do we apply this amazing new technology to better solve those problems? So think about it, from that regard, where you still got to really lean into the outcomes and how am I going to solve for that, and really drive and move those metrics, which I think that is where, with AI, there's a big opportunity. We can really move the needle on a lot of metrics that, we couldn't do prior to having this, great new technology.
Oh my gosh, that's exactly what I've been saying to my internal teams and external teams. Things being in healthcare for as long as we all three have, you just know there's problems everywhere, and that my approach has always been like, stay the course, do the next right thing, do the next right thing, do the next right thing. It will change, it will take time, but we will get there. This is the first time in my career when I'm like, it can really change. It can really change quickly. What would have taken an engineering team a year can now happen in 3 months. Like, it is rapidly enabling us to enact actual meaningful change in the space that we're also passionate about. So in my opinion, it's like the most exciting time to be in tech. It's overwhelming and it's, changing so quickly that can feel unsettling. I think from the league perspective, we're spending a lot of our time and energy understanding how that technology is evolving. And I'm constantly I totally agree with you, Josh. Focus on the problems we're solving. Don't focus on, the technology can take you in weird, strange places that don't solve a problem. Don't do that. Focus on your problems. Back to first principles. Think about it from, the user's perspective. And that's what we're doing. We're looking at our entire product experience and saying, where would AI make the user experience better? Let's explore that. And what problems were previously off the table, but are now on the table because we have different technology that we can leverage. It's a very exciting time.
it
Yeah.
is.
Yeah.
And I think too, you mentioned before going to ChatGPT to ask medical questions with, no hesitation. So I think maybe we discount that people are really ready for this. And if it's going to increase their experience, cut down on their time on hold, get them the answers they need quickly, then they're okay interacting with AI. Is that what you're seeing?
Oh, yeah.
Yeah.
Yes. Yes. It is like very rapidly becoming a go-to tool for, millions and millions and millions of people all over the world. The adoption is wild, unlike anything I've honestly ever seen in my career. How many people month over month are ChatGPT is adding to their weekly active users? It's crazy in all the best ways.
Yeah.
Yeah. Well, and it's making some of our, I gave the example with Expedia, the chat, it's making some of those experiences better where, and you heard me kind of laugh. I mean, we all remember those chat experiences 2, 3 years ago. I mean, a lot of them just didn't work. I mean, they were pretty bad. And part of, what we're seeing is, some of our kind of legacy tech, not that chat is that much of a legacy chat, but it's getting better. It's more accurate and more useful. So, the other thing I would, Jody, just going back to your question real quick that on startups, and I think this would be, something beneficial for the audience. And I, spoke on this about at a conference, I think it was a few weeks ago where, and startups probably hear this a lot. I know the ones I'm on boards are on, they do about platform solutions and a lot of payers and health systems, and I would always think that way where I would want to lean into a platform solution, and, you're thinking about technology debt, minimizing your vendor footprint. But I think AI is changing that a little bit. And at least for me, I would start thinking about, point solutions and some of these other, startup AI companies that were more nimble and were able to really come in and solve a problem that some of these other larger platform companies that have been around healthcare for, decades could not solve. They were not innovating as fast with AI. And I think it does create, an opportunity for some of the startups that are out there. And I would encourage them, go deep in your niche and really become an expert there. Because like that contact center example I gave, that was a point solution. And we were able to do that and really drive a tremendous ROI, even though we probably had the top contact center solution in the market, that platform. That point solution really drove more value.
I love that. I think a lot of companies in the audience will love that too. Justice for the point solutions. And actually,
Yeah.
that segues really well into the next kind of topic here about, I mean, AI has obviously changed the role of the payer, and the role of the payer has just generally evolved over the last decade when it comes to embracing digital. But just kind of talking about your vision for a member experience across all touch points, whether that's going through multiple, point solutions or working, through a platform. Just what is your vision for a member experience that coordinates a member's touch points?
Yeah, I would say for me,
Yeah,
it
go
would
ahead, Kevin.
be, oh, sorry, like a unified, seamless experience, right? In healthcare with coordinated approaches, a connected ecosystem that really all their needs and preferences are known and available, right? To ensure that continuity of care and that we're all aligned in that. So I feel like that's kind of, trying to make that seamless for them, for the members, patients, well, and really an interdisciplinary team as well, right? Because we know, there may be social factors going on that's affecting, and so just kind of pulling that all together, I think really supports a member through their journey, and nothing's more positive than receiving that feedback from a member, that success story from a member journey. So the choices that they had to make and how everyone supported them. So that would be my.
Yeah,
Yeah, and I'd add to that. I mean, I would agree. How do you make it seamless? How do you make it simple? You want to take the friction out of the process. And to weave together a few points we've talked about on the call here, where you want to do that internal to a payer, across all the different channels, engagement, touch points that you have with your member, your patient. How do you pull it together? And I talk about point solutions platforms. That should all be seamless. It should all be unified and completely seamless to a member. They don't care, but like behind the scenes, how do you bring all that together? And then, I think the opportunity, what I said earlier from a broader industry perspective is how do you do that across the healthcare ecosystem? So, payer, they need to do that internally, but and this is where it gets into the interoperability challenges. How do I make the experience seamless? And a good example I could use is, years back when texting became a big thing, medication adherence reminders. I remember when we started our first texting campaign, and I started looking at the call results, and our PBM was texting the same member the same day when they hit 90 days. Our health systems were texting them. They were getting 4 or 5 texts and just really confusing them on what to do. How do we bring that together as a healthcare ecosystem so that at that 90-day mark, that member, that patient gets, one text, whether it's from the PBM, the health system, or the payer. They're not getting 4 or 5 and confusing them. So that's the opportunity. So, it all starts with data, as we talked about, and then leveraging technologies like AI that we have that can really derive a better experience.
Yeah, I think for me, those are both the exact right answers. It's how does the healthcare ecosystem come together and really make things cleaner and simpler and easier for users to understand. To share this a lot, but I have a daughter with a chronic condition. She has cerebral palsy. She has about 100 different, not really 100, but many different providers, physical therapists. She has neurologists. She has a neurosurgeon. She has an orthopedist. She has the orthopedist person who makes her actual braces. So, and her, of course, normal kiddo doctor stuff, eye problems, just the whole gamut. And the coordination burden on people with chronic conditions, those high cost, high need individuals is, 10x, 100x that of a regular non-chronic condition person. And I really hope that by the time my daughter, who's 7 now, is a grown up, this is much easier for her. I want her to have the digital tools to get everything she needs handled in a simple way where she knows what she is going to end up paying. She knows what things are going to happen in what sequence, and that she feels really empowered to make good decisions for her own health. And so that's really like the vision that I share with the team at League, but that keeps me motivated to keep working at these tough problems.
Thanks for sharing that, Sarah. I hope that too. I know we have a few audience questions, but also just wanted to ask kind of if there's any engagement touch points that maybe surprised you about their impacts. Maybe you didn't think originally this was going to be a big deal, but you were hearing from members, wow, this really has been a much improved experience for me. Maybe it's that call center one, but just anything else, maybe even a point solution that you worked with that you didn't think would make as big of an impact.
Are you referring like to digital point solutions? I mean, we've had some point solutions that, we've had really good engagement. And what's nice is to be able to share the outcomes, especially from a prevention. We've had one digital point solution that really is a prevention management. And so I feel like that has been impactful. And it's also a good thing to share the outcomes because they share the outcomes. So, while we can share that internally, also sharing with our employer groups, right, who buy in for these opportunities as well. So I think that that's been a great thing. We continue to explore more digital point solutions, but I think that, sharing the outcomes has been impactful, and
Yeah.
and we've actually had member testimonials through it too. So I feel like that's important too, right? That nothing's more, more impactful sometimes than when you get a member testimonial from something too.
Yeah, you love the positive feedback. You get way more of the other kind of feedback, generally.
Okay, that's fair.
But one of the things that was shocking to me, I was reading about, I forget, like last week, an article on ChatGPT usage and the themes that people were using it for. And it's all over the map. A lot of people are using it for work and things like that. A lot of people using it for health questions. But one of the surprising yet not surprising adoption, one of the strongest use cases is for like mental health support. So understanding your own feelings and reflecting about why do you feel a certain way, or advice on how to navigate a complex situation. Before I was at League, I worked at a mental health startup for a number of years. And while it's surprising, it's also not surprising. I think the stigma for having mental health struggles or mental health challenges is still part of part of the world, and these digital tools take away one element of that stigma. I'm not having to tell a human. I'm telling, whoa, oh, my fire alarm's going off. I'm telling a computer. And so that's really interesting. It's powerful. It says something. There's lots of risk, and there's lots of things that as a group and as a community, we need to figure out how to make sure those are safe, responsible applications. But I think it does tell you something about new ways to solve problems that have been very hard to solve in the past, and users' eagerness for finding those types of solutions.
Welcome back, Josh. I thought you were frozen, but I'm like, oh, maybe he's just really good at being stoic. So I'm not sure.
There's a drop there.
So we do have an audience question around what agentic models you're using or exploring.
For us at Scan, one of the things we did, and it worked very well, we built a platform, and I'll put a plug in for Microsoft, using their Azure AI Studio. And we called it the ScanX platform, where we could plug and play different models, so the different LLMs based on use cases. So, give example, whether, I've got a set of, finance use cases, there may be, one particular model that we would leverage for that. So we could kind of plug and play. So more of a generic answer there than anything else. And then, again, as I said earlier, we had a number of, what I would consider point solutions across the capabilities from, we had solutions for our legal teams, solutions for our contact center, our claims operations, you name it. And what we were doing over time is, as these other, kind of these your LLMs would advance, we would look at, are their capabilities up to speed with these other point solutions, and can we fold them into those solutions? So that was something we were continuously monitoring and watching.
Yeah, and I would say, like I said, we are currently evaluating. So we know we are piloting with our phone system through our customer service agents, also looking at opportunities from a utilization management perspective, reading files and different things like that. So those are just a couple of the different things that we are looking at to support that.
Yeah. Okay, 2 minutes left. Any final thoughts for our audience? Any parting words?
I just hope everybody's as excited for change, ready to make moves. I think this is such a cool time to be in healthcare, and hopefully everyone else is ready to break down some walls alongside of us. It really feels like an important moment in time. So
Yeah,
hopefully
I love your positivity. I feel like I need a burst of that every day.
I'm here. Happy for a call.
Yeah.
I would agree with Sarah. I mean, we're at a pivotal point in time, and this is something we're going to look back on over, 10 years out, and it's really an exciting time to be in healthcare and technology overall.
I would agree. We continue to look to optimize, and also, be interesting to come back maybe a year or so and see what we've all done, right? And what we put into place. We know it's going to be kind of a vision over a couple years, but continue to move with that.
Yeah. Great. Well, thank you everyone for joining us today. I think the future is bright. The future of health engagement is bright. And I think the value associated with it will only increase over time, especially with the rise of AI and better use of data like we talked about today. So there's a way forward beyond friction, beyond fragmentation, and beyond legacy solutions. And we will further prioritize the consumer and the member, and hopefully provide a better experience every year. So thank you all for leading the charge and joining me today. And thanks everyone for tuning in.
Thank you to League and to everyone that joined us today. Please visit our website at community.hlth.com to catch up on all Health Go Live webinars and watch the recording of today's session. Don't forget to join us in Amsterdam June 16th through 19th for Health Europe.